Hi, my name is Bree. I am doing my return wound care demonstration video for NR224. I have in front of me my sterile kit, my makeshift wound, some extra gloves. I have my PPE, and I have extra cotton tip applicators along with um, measuring devices, along with the pin. At this time, I would knock on the door. I will introduce myself. I will verify the patient with two patient identifiers, normally the wristband and having the patient state their name and date of birth. I will then verify doctor's orders, ask patient allergies, along with if there are any pain, because I would explain that the wound care changing dressing process can cause pain. I will then explain the rationale. I will tell the patient that I'm changing the soiled wound dressing and applying a new dressing. I will then ask if they have any questions. I will ask if they have any goals, and I will obtain consent. If that all goes good, I will then perform hand hygiene. I will apply my clean gloves because this part is not sterile. Walking my patient through the whole entire process, I will carefully remove the soiled or previous dressing, pulling the tape from the outer sides. I will then remove the dressing, looking at the color for cocoa, which is color, consistency, odor, and amount. I will then place this in a hazards bag that I have to the side. I will then assess the area of the wound, the peri area, looking for slough, presence of and condition of drainage. I will look for undermining and tunneling. I will measure the dimensions, and I will palpate the outside of the wound. During this process, you will use a cotton tip applicator, making sure that you do not touch inside of the wound. You will use the cotton tip applicator for width, checking it against a measuring tape. 5, the length. 14, and the depth, which is 4. I will discard of this along with my measuring utensil. I will remove my clean gloves, perform hand hygiene. At this time, I will, one patient or one break. Before this, I would raise the bed to a working level so that I'm not straining. And then now I'll go back. I performed hand hygiene. I'm going to raise the head of the bed so that when I irrigate the wound, because you do top to bottom, that the drainage will go down. I'm going to open my sterile field, maintaining sterility. I pulled my gauze, or my sterile gloves. I'm going to put on my gown, mask, and gloves. At this time, I only have my gown. And then I have my sterile gloves, of course, making sure I maintain a sterile field with the gloves. I'll open them, grabbing from the cuff. I'll slide my hand in, scooping the cuff of the other one. I'll again slide my hand in. Gloves are sterile and in place. I will start to remove the items that I have in my sterile box. My box did not come with sterile water, so I will verbalize that I got the wound dressings wet with sterile water. I have gauze, tape, a measuring device. I'm going to open my cotton tip applicators and place them in a sterile field. At this time, I would put a couple my gauze in the basin and get them wet with the syringe or the sterile water. I would then pull up a 60 millimeter syringe of normal saline, spray irrigating the wound until the wound bed or the drainage is clear. I would then use my cotton tip applicator and the wet gauze to pack the wound. Patient student break number 2, I would use the gauze to pat the wound dry, discarding it in this biohazard bag. Then I would go in to use my cotton tip applicator to pack my wound, which of course there's a lot. So I'm still using my cotton tip applicator to pack this wound. I will discard this in the soil. I will then apply dry gauze. I will apply the appropriate absorbent pad. I will tape this wound. I will discard of my PPE into the appropriate bin. I will then perform hand hygiene. And at this time, you can apply another set of clean gloves. I don't have another pair, so I would apply another set of clean gloves. I would then label with time, initials, and date of when this was performed. I would lower the bed into the lowest position, assess the